be a billionaire so freaking bad.
Okay, can you tell us what your name is?
Aqua Marie.
Okay. So we're here today to interview Ms. Aqua Marie. So what do you think welfare is?
Well, welfare is the type of government help that they give people that can't afford, like, I don't know, that don't have money, they can't afford things like other people can, that have jobs, but also there's also people that lie to get help, and it's not fair for those who don't have the help.
Today we are interviewing Kim. Hello Kim, what do you think welfare is?
Well, I think that welfare, I know that welfare is social programs that are supposed to be government assistance for people who need it. Some of this includes Social Security, Medicaid, like just health insurance for people, and this also includes food stamps, and it also includes veteran benefits, Pell Grants. Okay, so we're here with Liz today. Okay, Miss Liz, what do you think welfare is?
I think welfare is help that people receive from the government, maybe in food stamps or insurance or
This
Medicaid.
is a chart showing that over 100 million people in the US are now receiving some form of federal welfare. This first bar is 2009 and they were under 9 million. This is 2011 and it was over 100 million. Today in 2012, there has been a count of 1.2 billion people who have been involved in fraud.
What would you like to be changed with the welfare system?
Well, first, I would like to point out that when you apply for welfare online or when you go into the office to apply through paper, I would like to point out that the documents are only in English and Spanish. So it's really hard for minorities such as people who speak Arabic, Chinese, or any other language to apply, which is really unfair because this is supposed to be America, the place of opportunities, and I don't think it's fair that people who speak English and Spanish get more help, receive more help than people like me.
Yeah, but they have people to translate the application and stuff. It's not like only Spanish and Americans can apply.
Yeah, that is true, but not everybody knows where they can receive this help from.
That if a person is on welfare because they are not working and they're not disabled and they're perfectly healthy but they're still on welfare, they can get welfare, but they need to have some type of income because you can't just, depend on government for everything. Yeah. I think people should have a job and, I don't know, have the lowest income, but at least they're working. Or at least even try to get a job, because most people on welfare, they're not even trying to get a job because they know that government will pay for their everything.
So what about unemployed people that are unemployed by no fault of their own?
Well, that's what I said. Like unemployed people, it's okay for certain, like maybe for 1 year, the most year and a half. Because if they're not even looking for a job and they're just sitting home, then that's not fair to people who are working and are getting deducted taxes.
Like I said, people lie, and they still be helping those
people. Pennsylvania had 11,726 children that are on the waiting list for child care assistance, when people who fraud welfare are getting their benefits.
How do you think welfare should be handled in terms of what groups should have it?
I think all groups should have the opportunity to have welfare as long as you genuinely need it. And like I said before in my last answer, I believe that welfare should really be for people who are disabled or old, or families with dependent children. I think that people like old people that have been working all their lives, paying taxes, should receive Medicare and Social Security because they've been paying taxes all their lives. And I think that all children should have.
This is a man who is a victim of fraud. Apparently one day his provider, Maxim, was found guilty because they were billing Medicaid for services he wasn't receiving. They were billed over $150 million that were improper claims.
So, who do you think should receive welfare? Who do you think mostly needs it?
I think mostly disabled people, and I don't mean disabled as in if they have you know, a bad eyesight or something, or even, okay, I've seen disabled people still working, because one example I have is a person could be working at movies, like if they don't have legs, they could still be in a wheelchair and work at the movies to give out tickets, because they don't really have to do that much, but at least they're trying. Like, I'm not saying they have to, you know, go on construction or whatever, but as long as they're doing some type of job and not just sitting around home, because even if they are disabled and they're sitting around home, it's gonna get them worse.
Yeah. And no, because it's not everybody that needs it. So I really think that they should constrain welfare, or like at least change up the qualifications for it. How has the welfare system affected you? In what type of ways? Has it even affected you at all?
Well, I don't get welfare. Because they don't give me welfare.
But I'm saying, like, has like the taxes that they take out of your paycheck affected you at all, or your family?
The taxes go up.
Yeah.
And they give my husband less money. Because they take a lot of taxes from people. And that's not fair.
Yeah, it's not.
I want my money. I don't know why they keep taking a lot of money.
So how has the welfare system affected you or your family?
It has affected me because like taxes are raising. I have to pay more for products when I go to the store. My mom gets less from her income because you know, the taxes are going up because of welfare. Well, mostly because of welfare.
Yeah.
That's not the only reason.